Good afternoon, everyone. Welcome to the Children's Funding Project. This is the cost modeling webinar. My name is Sarai Cook. I'm a citizen of the Muskogee Nation and a senior fellow with the Children's Funding Project. The Children's Funding Project has been working successfully with state and local governments for several years now, helping them map resources, providing cost models, and providing revenue generating technical assistance, and has had many successes. So we want to go over those today in this webinar. So they hired me to see if we can expand our technical assistance program to meet the needs of tribal nations. In this webinar, we will discuss the cost modeling process. We will show you the process and how this process is being used in other communities as a planning tool to demonstrate the true cost of quality childcare. So as we go through the webinar, we have the chat box open. So please feel free to put your questions into that box, and at the end, we'll have time for Q&A. So I will read those questions out and have our subject matter experts answer those questions. So now I'd like to hand it over to our CEO. Her name is Elizabeth Gaines, and she'll talk to you a little bit more about our long-term goals.
Thanks, Sarai. So really excited about this webinar and really the sort of more public-facing launch of an effort among all of us at Children's Funding Project to learn and to begin thinking about how the work that we do really can be of assistance to and be sort of informed by the experience of those leaders in Indian country and those working on behalf of Native youth. I am personally a lifelong child advocate. I worked at the state and local level and for a long time, both in direct service with young people and as an advocate in my home state of Missouri. Found that as a field, though, those of us who care about and work with kids aren't that well versed in financing and in budgets and in tax policy. And therefore, we're not always coming with the confidence to secure resources that would make a huge difference in young people's lives. So started Children's Funding Project a few years back, as Sarai said, to really help laser focus in on the money. And, really excited that we brought Sarai onto the team to help us think about what this financing work can look like in tribal communities. And so, the big things that we've been busy doing over the last crazy couple of years that we've all been experiencing is really helping people think about managing and maximizing federal relief funding. So American Rescue Plan has presented lots of opportunities to do some things that we've all wanted to do for kids, and it's been a matter of figuring out how to operationalize that money. Strategic finance planning is a piece of sort of work that encompasses a whole bunch of things. You're going to hear about one piece of that, cost modeling, today, but we think it's really important to understand what the current set of funding streams we have to work with to help our kiddos is, what the true cost of providing them with really rich cultural and high quality experiences is, and then where funding can come from to fill those gaps. And so we've actually helped a number of communities in our first few years here to actually dedicate public funding to children in their particular localities. So we want to learn as much as we want to share what we've learned. And so just looking forward to this conversation.
Thank you so much, Elizabeth, for all that great information and that history. It's always good to have the history and the principles of an organization, all that knowledge. So thank you for that. So next we'll we're going to introduce Jennifer Ratcliffe, and she's going to talk about our upcoming webinar series. She's graciously been able to co-host these webinars with us. So thank you so much, Jennifer.
Sorry, I was on mute. Thank you, Sarai, and welcome everyone. I'm so excited to be here to be talking about this today. This is such an important conversation to be having where we're sitting. I love that we just referenced the opportunities that are in front of us, because there are a lot of opportunities ahead of us that we're sitting on right now, and really honing in on how do we maximize these opportunities to really serve our children the best. So again, I'm Jennifer Ratcliffe from the National Indian Child Care Association. I am a member of the Cherokee Nation, and I am coming to you from Tulsa, Oklahoma, which is in Cherokee territory. I just want to briefly share with you the series that we have coming up. The next session is on how federal funding tools can help tribal nations support child and youth programs. And we'll be looking at the Children's Funding Project's federal funding tools, which includes funding for tribal nations. We will be highlighting how tribes are using the American Rescue Plan funding to support children and youth from those that are tracked in the Children's Funding Project's online database. We'll be previewing federal and tribal funding maps and explaining how the fiscal mapping process can help administrators align funding streams to improve outcomes for children and youth. Then our third and final webinar on November 2nd will discuss ways to expand opportunities for children through emerging funding strategies. As you all know, federal grants come and go, and there's lots of reporting requirements and regulations you have to follow, and restrictions that are put on those funding streams. And those often inhibit access and honestly will to take those funding streams and to implement them. But by making intentional investments and using more innovative financing mechanisms, interested parties and tribes can be at the forefront of improving outcomes for children by improving the quality and availability of services through new and innovative funding streams. So these webinars are going to lay out some landscapes for us to explore how to really maximize the opportunities that are ahead of us and really make great strides in improving access to early learning opportunities, improving the quality of early learning services, and really just serving our communities and our families even better than we are now. So super excited to be co-hosting this series with the Children's Funding Project, and excited to just embark on today's conversation. Thank you.
Again, Jennifer, thank you so much for having the confidence in our organization to help us along with providing this information. So the next speaker we'll have is actually our subject matter expert. Her name is Kate, and she is a cost model subject matter expert. Since 2001, Kate has been working with state and local governments, foundations, national policy organizations, early child care and education providers, and child advocacy groups to provide strategic early childhood policy and finance recommendations. Prior to joining the Children's Funding Project, Kate consulted with cities and states on creating comprehensive early childhood, their system cost models. Kate worked with the Illinois Governor's Office of Early Childhood Development, where she created a cost model for the state's quality rating and improvement system and led the process to develop a quality rating and improvement system for family child care. So Kate is going to go over the cost model process. And then later on, we're going to talk about a pilot project we're going to do. And she's going to also go over some of the state cost models that she helped to develop.
Thanks, Sarai, and hello, everyone. I'm so happy to be here today. I always love talking about cost models. And I do just want to say that this is really exciting because I have done a lot of cost models across the nation for various states and cities, but I haven't ever done a cost model for tribal early childhood program. And so what I'm going to present right now is the way that I have typically done and approached cost models, but with the understanding that some of those structures and assumptions might look very different when we're working with tribal nations. But just to lay the groundwork, a foundation, of what is a cost model. It's an approach to measuring the true cost of implementing and maintaining a service or a program. So it accounts for all the components that go into that program or service. And for our purposes today, we'll assume that program or service is an early childhood program. And it attaches a real cost to each component. So places can have a variety of goals for creating cost models. The most common is to understand the true cost of providing early care and education on a per child basis, or on a per classroom basis, or a program basis. And then more recently, places have been engaging in cost modeling to understand the cost associated with improving teacher compensation. They recognize that early childhood staff are woefully underpaid and want to look at how that impacts the cost if they have a better compensation scale. Another common goal is to understand the cost of improving certain quality components. So things like a smaller class size or including mental health consultants. And then sometimes it's understanding cost differences in various regions of a state or different types of care, like a center-based program versus a home-based program, or different program sizes. So there can be many different goals once you start digging into the true cost. And then as more places have undertaken the cost modeling process, we've seen that it's useful in a lot of different ways. First and foremost, cost modeling has become more common because in the last reauthorization of the Child Care and Development Block Grant, so the biggest federal funding source for childcare, it included a provision that encouraged places to conduct a cost model as an alternative rate setting process to what was traditionally been done is a market rate survey. And I will go a little bit more into the difference between a cost model and a market rate survey in a moment. But by doing this, we've seen a lot of success in places using cost models to set appropriate reimbursement rates for childcare services. So these are rates that are much more closely tied to the true cost of care, which helps to stabilize the programs. We've also seen places use cost modeling, as I mentioned before, to improve childcare, to improve wages for childcare teachers. And we saw this done a lot with COVID relief funding. So using cost models to understand how much funding should be awarded to programs to make sure that it would impact staff wages. And then last, but certainly not least, we've seen places use cost modeling to illustrate how underfunded early childhood is at large, and it currently is and has been, and then to make the case for greater funding or for the need for more revenue. So it's a powerful tool that really puts defensible data at your fingertips. And then, sorry, back one slide, Sarai. Just how are they created? These last two, number 3 and number 4, is kind of, we use an ingredient, what I think of as an ingredients method. We look at all the ingredients that are needed to operate a successful early childhood program. So the first thing we look at are structural components, and those are things like any programmatic requirements or licensing standards that kind of create the structure of the program. It includes ratios and group size. Those are a huge structural cost driver. We know that it has a big cost impact if your licensing standards require 3 versus 4 infants per adult, or if they allow 12 2-year-olds in a room versus 16 2-year-olds in a room. Those are all really critical structural components. Geography can be another structural cost driver. For example, in some places we see that costs are a lot higher sometimes in large urban areas, and those need to be accounted for. And then another common structural cost driver are minimum wage requirements. And then the other component, the other kind of ingredient piece of it, are the operational cost drivers. And those are all the other ingredients that are needed to make the program run. So things like, of course, staff wages and benefits, rent or mortgage, utility costs, food, education supplies, curriculum purchases, really all of those non-personnel items that are in an early childhood program professional development, licenses or permits. We try and capture every single one. And then we also incorporate what I'm calling on here quality add-on components, and that's really a loose and very general term. But it essentially covers additional components that may be specific to a certain type of program or service. So for a tribal program, that may be something like a person who comes in and does tribal language instruction or cultural education. So really we try to customize it and then take those elements, and we also have to quantify it and put it into the model. Okay, next slide. So I mentioned before that a cost model gets at the true cost of care as opposed to the market cost. And really the better way to think of this is market price versus true cost. So typically in the past, the Child Care and Development Block Grant required places to do a market rate survey and set their provider reimbursement rates on that market rate survey. And the market rate or the market price is essentially how much families can afford to pay. So it reflects what a provider charges in order to fill the classroom. So providers charge what families in their area can afford to pay, so they ensure that they have classrooms that are filled. And the average market cost or price of childcare ranges from $12,000 to $15,000 per year. By contrast, the true cost measures the actual cost of providing care. So it includes all those components that I just ran through. It accurately differentiates costs for infants and toddlers, which are significantly more expensive than preschoolers and school age costs. And we find that the average true cost of care can range anywhere from $20,000 to $30,000 per year. So it's a pretty significant difference once you're looking at those actual costs. Next slide. Okay, so this is the approach that we generally take to cost modeling at CFP. What we first do is we convene stakeholders and gather relevant information. So during this step, we determine who are the relevant stakeholders that need to provide input to build consensus, and that should be informing the process. And during this stage, we also determine the parameters of the cost model. So really what it is you hope to learn from it. What are the variables that you want to be able to play with to see cost differences? And then we begin compiling the structural cost drivers that I mentioned earlier. So any licensing standards that apply or programmatic standards that apply. And then the next step is all about the data. And this is really critical. So a cost model is only as good as the data that goes into it. The more accurate the data, the better the cost model will represent programs or services in your tribe. So sometimes we pull available data from places like the Bureau of Labor Statistics or market rate studies or salary and staffing surveys. But for data that isn't readily available, or for places that want to dig in a little bit deeper or get more specific on their geographic area, we conduct a survey of relevant providers or programs to ensure that the data that we're putting in represents reality. We also pull revenue sources that are available and commonly used to fund a program. So for early childhood, that's typically looking at things like subsidy reimbursement rates, Head Start or Early Head Start, food program rates, and things like that. And then the last step of the process is compiling all the data into a cohesive and user-friendly cost model tool. And the tool is designed to allow the user to change variables and understand cost impact. It contains formulas that appropriately capture and attribute costs to classrooms or ages to provide a true cost of care comparison. And we create it so that it can be dynamic and have longevity to it, so that any of the back end data can be easily changed as, say, wages change, or say your ratios or your licensing standards change. Those can be easily updated so that the cost model tool has longevity and you can use it as a tool over the course of many years. So just to clarify, because I feel like that's a lot of kind of jargony talk about cost models. It's generally an Excel tool that allows you to use it. I have a couple examples to show. So I will pull up an example. So this is a cost model we created for Wisconsin. Can everyone see my, sorry, can you see it?
I do.
Okay, great. So what we have here is a cost model that we created, as I said, for Wisconsin. They had a strategic priority around improving childcare for infants and toddlers. So they wanted to understand the true cost of infant and toddler care. And they also very specifically wanted to understand the cost difference when teachers and staff were paid better salaries. So there are many, many variables that needed to be incorporated for Wisconsin. The first one you'll see here, the variables are generally in green. They have 4 different regions of the state that have different costs of living. So we needed to be able to differentiate those and allow them to see if they're looking at region A, what the costs are versus region D, what the costs might be. And then they also wanted to make sure we were differentiating costs between a general license center versus a center that was running Head Start or early Head Start classrooms, since they have smaller class sizes and lower child to teacher ratios than Wisconsin's general licensing standards. So we incorporated those variables in. They also wanted to understand the true cost for each quality level as determined by their state quality rating and improvement system, which is called Youngstar. So here it's abbreviated YS. So we put in each different Youngstar level. They also wanted some particular quality add-ons for priority populations, so they could select yes or no to see those cost differences. And then in the orange are areas where you fill in numbers. This is one standard variable that we include, which is estimated enrollment. We know that program enrollment has changed dramatically in post-COVID world. So it used to be assumed that most programs were approximately 85% enrolled on average throughout the year. That is not the case right now. So this variable can be changed to allow the user to see if programs in the area are generally 50% enrolled, what does that look like for the cost versus 85% or 100%. And then similarly, the number of classrooms can make a big difference. If it's a really large program that has 5 classrooms at each age versus a small one with 1 classroom at each age, you can see kind of understand efficiencies of scale and cost impact for smaller programs. And then over here on the right, you have all the results. These blue cells are the results. So this really allows you to see the results of all these variables that you chose. So for example, you can see the cost per child for an infant and toddler is about 14 or 15,000 as compared to the subsidy rate, which is just under $10,000. And you can see the percentage of a rate increase needed to meet the true cost of care. And then below, as I said, they really wanted to look at what the cost difference was using recommended salaries for teachers and staff. And so here you can see the same result cells with these updated costs of care or costs based on higher salaries. So there's a lot of, and as I said, this had a lot of variables to it. They also had current staffing structure versus we created a recommended staffing structure that allowed more time for planning and curriculum development by teachers. So all those pieces can be added in. And as I mentioned, there are these tabs in the back that we try and make really easy and to understand and labeled well so that you can easily change things as things may change over time. So that was one example that I just wanted to provide that kind of focused on infant and toddler care. One other example is from Boston. And so Boston was a little bit different. We created for their universal preschool program. Their universal preschool program, shortened UPK, is through the public school system. But they fund it, they fund community-based childcare centers to have UPK classrooms. But what they were hearing from providers is that they were backing out and didn't want to run a UPK classroom anymore because they weren't getting enough per child to make it worthwhile. It assumed 100% enrollment all year long. And another big piece was that the program, UPK, since it's run by the public school, the hours and the days needed to match the school day. So 6.5 hours per day, 180 days per year. But providers said that this was really problematic. It didn't match their business model, which was to meet the needs of working families, which needed 10 hours of care per day and about 260 days of care per year, a full year. So they were going to close their UPK classrooms. So we created this cost model to understand the true cost per child as well as the true cost per classroom. And you can see we also prorated by the number of hours and days so that we could see the cost difference between a public school day year versus how a CBO typically runs. And we use this information to work with the group to develop a more stable funding mechanism that would allow providers to keep their UPK classrooms open within the current context. So we pulled, I'll show you one of the messy back tabs. We pulled their biggest expense here, which was staff. So we basically pulled the teachers' salaries and any related salaries. So directors and family childcare or family engagement specialists that worked with the classroom, we pulled their salaries because those were fixed costs. So meaning they're the same regardless of whether there are 12 students in the room or 18 students in the room. Those teachers and staff are there and have to be paid for. And so we pull those costs to make a kind of a base level of funding. And then to encourage full enrollment, the remaining cost is based on a per child add-on. And then if they have this base level of funding, which includes staff salaries, the benefits, and then a per seat add-on per child, they get pretty close to the full cost of care for the classroom. And then the rest of it is filled with, as they already know, they meet the additional costs through the food program and some subsidy dollars. So it really created they used this cost model to create a much more stable funding mechanism for those classrooms. I'm going to stop sharing my Excel spreadsheets before I make everyone fall asleep.
Did you just want to say anything on the facility development?
Yes, I think I'm turning that over to Elizabeth to say something. But I will, after this, definitely take any questions on cost modeling because I know that was a lot of information.
Well, and the very first question in the Q&A is about facilities. So we knew this would be an issue that would come up, and there are some really great folks that we partner with who, if folks are trying to think about those big upfront investments or big, sort of as what did the question say? Something about maintenance and upgrades in facilities. Those sort of one-time big costs, Kate, you don't figure into the ongoing cost model, true?
Correct. So maintenance would be in the cost model because that's ongoing, but yet an upgrade or an addition or a big one-time cost would not be included.
And for those, we typically turn folks over to our friends in the CDFI business because they're the ones that are making the kinds of loans that are necessary to do that work, and sometimes grants, and have a lot of expertise in facilities. So I don't know if we've got folks on the line here, but First Children's Finance, the National Children's Facilities Network, those are all good organizations that we can actually put in the chat to direct people to on facilities. So.
So big picture, why are we doing this? Big picture, we want every child to be fully resourced. We think cost modeling can be helpful to tribal nations. At this current time, we only have models that are helpful, or these models that we've developed have been helpful and successful in states and local governments. But we are prepared to throw out all of our preconceived ideas about cost modeling and design a cost model technical assistance program that can positively impact tribes. We know that there are differences in the way that cost model will need to be done, and we want to work through our current model so that we can provide this technical assistance in a culturally appropriate and respectful manner. So we have a pilot project, and this pilot project, we will do a cost model for a tribal nation, and it would be great to work with the tribal nation and see what's needed in the early childhood development space. We have made an application, and it's very brief. We've made it as brief and as easy as possible to flesh out all the important information that we need. But we wanted the application to be low barrier. So this application will be sent out with the follow-up email to all of the participants, and the application will be due November 1st. And we want to get started on the pilot project in early January. So after this webinar, I'll send out the pilot project application to all the webinar attendees. So if you or if anyone you know is interested in the pilot project, please send them the application link or guide them to our website. It'll also be on our website. This is my contact. You have my contact here with my email and my phone number. And at this time, I'll go over the questions from the chat box. And let's see. So we'll have Kate or Elizabeth or myself answer questions. Let's go to the Q&A first.
And Jennifer too, I think, some of the things you're putting in the chat, I think are interesting just to think about how this gets applied in the universe that you specialize in, I think.
Okay, so the first question, I think this would be for Kate. Is this cost model Excel sheet a template available on the website, or does it need to be purchased?
That's a great question. So it's not available on the website because, as I mentioned, it's very tailored to the whatever the goals are, the variables, the region. So each one looks different, but what we are in the process of creating is a framework to help places that want to do their own to create an Excel spreadsheet like the one you just saw that leads you through kind of the steps and what kind of information you need to put into it. But a template or making what I just put up an available template probably wouldn't be very useful to most people because it's so specific to whatever that need was.
But that's the beauty of the pilot project that Sarai just was mentioning, is that if you apply to be a recipient of that sort of pro bono support from Kate and team, you'll get something like that out the other side of that project.
The next question is, how many tribes will be selected for the pilot project? So at this time, the children's funding project is fully funding this effort for the pilot project. So we're only able to select one participant for the pilot project, but that's with the hopes of being able to provide this technical assistance broadly in the future. So we just only right now have the resources to work with one tribal nation. So now I'll go over to the chat.
Can I ask a question about the project, the pilot project? What is the time investment, like the length of time? Is it 6 months? Is it a year? What is it that for the person that you select, what does that look like?
Okay, so we put 6 months to a year on the application. So it could be anywhere from 6 months to a year. And then the actual time investment would be about 5 hours a month for the program that's selected. Is it possible to see a recording of this webinar after today? I would love to share it with a partner.
Yes is the answer. Yes is the answer.
Will we have it posted anywhere?
Yeah, Shane will make sure that we send a follow-up to anybody who registered with the
Okay.
link. Shane, make sure you do that.
Okay. Mhm.
Kate, while Sarai's looking through the questions, you should talk about the provider cost of quality tool.
Yeah,
and the
I
limitations.
just saw someone asked a
Yeah.
question about that actually. So yes, the provider cost of quality calculator is a great tool. It's yes, a free online tool. Anyone can use it. You can get an estimate of the cost of care by age, by different quality levels, based on, but those are the parameters. So you can get kind of a quick and dirty estimate for the cost of care. The tools that we make that I just showed use the provider cost of quality kind of ingredients method. So a lot of times if we don't have non-personnel costs, we'll rely on what's in there. But we just tailor it a little bit more to whatever the needs are, but it's a great starting place. And I love that tool. And the person that created it was the person who taught me how to do cost modeling. So I definitely support the PCQC, the provider cost of quality calculator.
We have a question. Do applicants need to be tribes? What about indigenous-led nonprofit organizations that operate on tribal land? Please go ahead and just submit the application, because we're just really looking for a comprehensive program that we could have the most impact with. So please submit the application. Any partnerships between blended or braided funding with state preschools, state childcare, and state Head Starts? Any sample MOAs and cost sheets?
That's an awesome question, and it feels like a 2.0, right? Like and maybe Jennifer, you have examples of that, and maybe we can start to uncover some of those as we get more into this space as an organization at Children's Funding Project. But it feels like that must be some territory where there's some things to mind in terms of just best practice and how you do really work across state-funded childcare and tribally located childcare in a effective way. Do you have?
Yeah, we work with some tribal childcare programs across the country who really effectively braid Head Start, early Head Start childcare partnerships, CCDF, state resource and referral funding, private tuition. I don't think they had a preschool grant, but all of those funding streams were pulled together and implemented in such a seamless way that not one family to the next family knew who was receiving what services from what stream of funding. So it's out there, I guess I would say, and we do have some expertise, a few experts in our pockets who have really successfully implemented those braiding strategies. But that would be a really important component to kind of thinking about once you have the model of what the cost of your care is, now where is it coming from and how do we put it all together? I think you're absolutely right, Elizabeth. It sounds like a wonderful 2.0.
Thank you.
And it relates to, you know, Sarai, to this comment, this last comment that just came in about if only one tribe is selected, you know, how do we share the results of this pilot in other communities and also then get feedback on, because that's the point of a pilot, right? Is to learn some things and to see where, you know, there are problems of practice or what have you that we can tweak and work on. So yeah, reporting back to this group on what we learn. And I don't know, Sarai, if you saw up top, I asked a question of the group in the chat and people are responding with some interesting things around, you know, what, as Kate was showing her tools and the variables that went into Wisconsin or to Boston, are there similarities? Are there differences as they would think about, you know, figuring out costs in this tribal setting? And people had some interesting responses around language and cultural inclusion as some things that might be a cost driver. There was one in here about relocation costs. I thought that was really interesting for staff that have to be recruited from outside the community, and costs associated with retaining employees. I mean, Kate, I don't know if these are things that you've come across in other cost modeling work that you've done, but it's interesting to me.
Yeah, absolutely. I think, and especially doing cost models for various quality levels, there's always more things that are getting added on, and trying to quantify them is really important, making sure we have the right cost. I did see someone make a comment about, I can't find it now, but that a lot of times there are higher costs associated with particular services or comprehensive services. I think an example was given of Alaska, which that's really true. They have all these additional costs around flights and, you know, really remote, hard to reach places. So all of that gets captured in the cost model. We quantify
A friend of
it.
mine was an adolescent health coordinator in Alaska, and she sometimes kayaked to the places that she had to visit to do her training. So, you know, it's like some time investment there.
Yeah. And the cost of the kayak.
There you go. Yeah.
So a concern I had in developing this pilot project was, are people's data going to be shared? And so we need to be really upfront with, you know, how we're going to share that, what's going to be shared, so that people know, you know, I mean, of course that's a concern, but then it's also wanting to learn and grow. So Kate, you had some really good answers for me as far as people's data being shared.
Yeah, thanks, Sarai. So when we do things like surveys to inform a cost model, we do keep the responses of individual programs and providers confidential, but we aggregate and average all the data. And that is what you see. So like the cost models that I just showed you, you can see those numbers. Those are all it's aggregated data, it's average data, but you won't ever see ABC childcare pays their staff this, they charge this, you won't, their mortgages, that you don't see that. And that's also why a cost model, I want to be very clear, is not an individual program budget. It is an average of, it captures costs. So it might look slightly different. Say if you're in Wisconsin, that might look what you saw might look a little different than what yours are, but in general, your costs are captured. Maybe you have free rent or mortgage, you get it in kind, and so you invest a little more in IT services or something like that, but generally the costs are captured. But what we would like to do is, yes, be able to share the results with averaged data and also share the process. So go through this process with the tribal nation to understand some of these components and the assumptions and the structures, and capture that process so that it can be useful for other tribal nations going forward. That was more than just the data. Sorry, I just went off on a tangent.
That's good, but definitely having that conversation and seeing what people are feeling comfortable with, and, you know, having a good understanding and being super clear on what will be shared. Right? So
And I think I also, from kind of a even further perspective, so sharing what we learned from cost modeling in your pilot project, even that can be somewhat de-identified and saying, you know, if the tribe is not interested, you could simply say, this is a tribe from the Northern Plains. And so you kind of have a sense of what that looks like in terms of rurality and, you know, weather and environment, and you can kind of get a sense of the bigger picture without necessarily having to say this is Fort Peck or, you know, any other random or any other specific tribe that you're working with. So I think that there's a lot of opportunity in that and being able to share what we find from this pilot project, even if a tribe isn't comfortable with saying, I want you to share my example explicitly.
or on the other spectrum, they could come along and share with us. Share if they wanted, if someone wanted to, you know, be that spokesperson.
Which is what we hope, because we need to share information so that we all have a good understanding of what this actually costs and what it looks like. Because I think in our country in general, we have no idea about how much it actually costs. I think people generally understand that the cost of care is actually more than what I actually pay as a parent and a family, but what is that actual number? I think most people are sort of out in the great wide open of I have no idea. So important to get it out.
We've not been doing a good job of articulating the real cost. And so when we go to policymakers or go, you know, to folks to say, we need more resources to put toward this public good. It's really a public good. We talk about it like a business, but really it's a public good. And we say we need $1.2 million when really we need $120 million. We're not doing ourselves a service, because then, you know, we're not able to get the outcomes that we want for our young people. So, you know, we've really just got to start naming what the real cost of this is, so that, and this, Kate, you made a really great quote at the very beginning about making this defensible. I sent a note to our communications director to say, make sure you get that quote down from Kate. I don't remember exactly what you said, but it was a good one.
Probably about defensible data. I always like data to be defensible.
Yes.
Elizabeth, when you say public good, what does that mean?
Well, I mean, we all, you know, pay taxes to some extent into a central place to pay for things like roads, right, that we all drive on, and it is a public good that we all have acknowledged is a necessary part of living in a community, right? Childcare is not just for the parent to go to work. It's not just for the child to get, you know, the education. It is something that benefits all of us because we're raising young people to be, you know, thoughtful and community driven and all of the good things that come out of an, you know, quality early learning experience. And it is a public good. It is not just for me, the parent, or for, you know, the child themselves. So.
Thank you. So Kate, have you used the provider cost of quality calculator? It's a free online tool.
Yes.
Quality.
Yeah. Talked a little bit about the PCQC. And I think Sarah put the link in. So if anyone is interested in trying it out, the link is in there. And it's also, just so folks know, it's a little bit clunky your first time using it. They are updating it to make it more user friendly. And yeah, it's a great tool.
Next question, is the state licensing rating the only quality indicator you account for in your cost model? How or where do you account for quality of curriculum, child outcomes, coaching for teachers, and things that could be measured through tools like class observer tools?
Great question. So those are all accounted for. We put in teacher professional development. We put in a cost for curriculum, for child assessments. Really anything depends on the area or the standards. So licensing standards are generally thought of as the base level of like what you just have to meet to be able to open your doors. And then there's a number of different quality components or add-ons that we can include if those are something you want to see, how those impact cost. Maybe there are some programs in your area that do more comprehensive care with some of those add-ons, and there are some that don't. We can make that a variable that you can kind of turn off and on to see how that impacts cost. But really, any of those components, that's part of what the process is learning what needs to be included in the model, and it looks so different everywhere we go.
I want to add something to this part of the conversation about kind of what pieces are considered in the cost model. And I had put in the chat earlier, one of the areas that is standing out to me that we might have to figure out how to consider is how do you incorporate language and cultural teaching, immersion, language nest. There's a sort of all of these different ways in which tribes bring in their own language and culture, and there are costs associated with it. So how does that play into it? So I think I'm assuming in your pilot project, this is kind of one of the things that you want to explore, but I think making sure that we're really intentional with what that looks like and really learning from others what those costs are to be able to adequately establish what that looks like in the model will be really important.
And can I just reinforce that, and Kate, you said this, but I want to reinforce it, that Children's Funding Project never comes in and sort of says, here are the variables you should be using to do this. I mean, there are certain things that we just know are going to be costs that we help you put in there, but like Kate's really good about sort of saying with a group of stakeholders in the place, well, what are the values of the thing that you want to create here? And, so what needs to be included? So I think it's a really good opportunity to figure some of that stuff out.
And I think that's the value of a pilot project with the tribe, right? We get to be able to kind of start exploring what are these nuances within tribal communities that are important to consider, that might not be held by others. But we also, I know you all recognize this, that what happens in the Northern Plains is probably going to look different than what happens in the Southwest. So to kind of get to a question or a point that Candida had in the chat was, how does this work given that the pilot project is just one tribe? I think that we're starting a journey of exploring what this looks like for individual tribal communities. I'm going to let the fund really talk to this because they explained it really well to me. But it's really a journey, and we have to start somewhere, and starting with one is where that journey can start, and then we can start exploring and better understanding how this model can work in another community. What do we need to make sure we're capturing that's going to be different? And sometimes it's going to be, if we have a community that has lots of native speakers, I know that doesn't really exist, but if there's a community that has more native speakers than one that doesn't, the cost might not be as great, simply because you have a larger pool to pull from. So I think us starting with a single pilot project is really starting us on that journey of how this can affect and be impactful for a larger audience.
Thank you, Jennifer. So next question is, I know cost models can be used to help set subsidy rates as well as inform pay parity efforts. Are there any other uses that you've seen?
Oh, yes, there's so many. So it can, like the Boston example I gave was to create a whole different funding mechanism. So it was used for that. It can be used to look at different ages, to create, to look at the gap in what funding is available and how much funding is needed. So you really can use it for a huge host of goals. Some places use it to see how much it costs, if they're proposing changes to their licensing standards or eliminating a type of care. It's been helpful in like looking at those things and how many parents you can look at, like how many take it from the per child or per program cost to how many families are using it, and what kind of an impact that would have. I mean, it starts small, but you can use it for really big things too.
Thank you. Are there any cost models for evidence-based home visiting that includes infant and early childhood mental health consultation?
Yes, I did. I put one in the chat and then I realized that I only put it to Sarah. So I'm putting it into a link. There's one really great one that I know of that Illinois did for evidence-based home visiting. And I put a link in the chat to it. Home visiting is definitely an area that places are cost modeling, but not nearly as many have been done as there have been for early childhood, like childcare and family childcare programs. Early intervention is another area that people would really like to cost model, and we really don't have a good ground basis for that. So that's another area that we'd like to explore.
And of course, because we care about kids cradle to career, we're also interested in costing out things like after school programs and youth workforce development. And we really feel like it's important to have a true sense of the cost of being a kid, raising a kid, just, making it through those first 2 decades of life, and what are the programs and supports you need, and what do they cost, and who are the professionals that provide them, and where can the money come from to do it? So we're kind of trying to explore all of those things at Children's Funding Project.
I see 2 Q&As.
Sorry, I just answered one.
Okay.
I didn't know it was going to go away.
So considering tribes are different in their governance, what are the priorities or criteria for being selected? I'll be sending that out, and the announcement covers all that. It has all the information about, how we're trying to make our selections, but it's really on the project and how impactful it will be. And it's also the stakeholders that the interested person is able to get to the table. And because we will have to ask for a lot of information in order to do the pilot project, as far as financial data and things of that nature. So it's our people, the person that's interested in doing the pilot project, are they able and have access to the data that we'll need to do the pilot project? That's a really important one. Okay, so
and can I just also say, Sarai, to the notion that well, wait, why are you only selecting one tribe? We want to get started on this. We are certainly not going to be throwing away people's applications. We're going to go, okay, there is enough interest in this that we think it's worth going and figuring out how to, get somebody to pay to, make this happen for a group and have a cohort. If that's, the right next step, we're going to be open to figuring out how to make sure that people who want to do this kind of work have access to the tools and the experts to do it. So though we're picking one just to get started, it's,
we went from nothing to something, and so we had to start somewhere.
Yeah, that's right.
So I just want to, and we have 1 minute left. I just want to say thank you so much to everybody for joining. I hope to see you, or we hope to see you at our next webinar that's going to be held next month. And I'll be sending out an announcement about that. And my apologies if I didn't see someone's question or comment, but hopefully we can continue to work together in the future.